Tonight at 5, Myasthenia Gravis, a disease that we may have all heard of. And for those of us who haven't, you're going to tonight. What is this disease? How can we combat it? Who is prone to developing it, and what can we do to help fix it? I'm Jonathan Thomas, and this is Tonight at 5. A big shout out to myself for that wonderful intro about myself and myasthenia gravis. Thanks for tuning in to Tonight at 5 with Jonathan Thomas. I'm Jonathan Thomas. Tonight at 5, weak eye muscles, drooping eyelids, difficulty swallowing, and shortness of breath. These are just a few of the symptoms that an individual with myasthenia gravis experiences. But how many people truly know what this chronic neuromuscular disease is and how it can affect people? KTNV Action News' Consuela Gabriela de la Rosa Ramirez Peña and Stan Smith have this story covered for you.
Thanks, Jonathan. I'm Consuela Gabriela de la Rosa Rodriguez Peña.
And I'm Stan Smith.
Myasthenia gravis is a chronic autoimmune neuromuscular disorder that causes weakness in the skeletal muscles and worsens after periods of activity. You heard me right, chronic. That means it stays with you throughout your life. Myasthenia gravis improves after periods of rest, so it is important for an individual experiencing a flare to take care of themselves. Let's break down the 5 W's of myasthenia gravis. The first is what? And I've already told you about that, so we'll move on to the next one.
Where does myasthenia gravis affect the body? The answer is unfortunately everywhere. Weakness can occur in the arms, hands, fingers, legs, and neck. Ptosis often occurs, which is the drooping of one or both eyelids. Diplopia can also occur, which involves having blurred or double vision. Changes in facial expressions, difficulty swallowing, shortness of breath, and dysarthria, also known as impaired speech, can also occur. Sometimes in severe cases, respiratory failure can occur. If so, immediate medical attention is necessary. Despite all being said, myasthenia gravis can be managed and people can remain functional in their activities of daily living.
Now for the win. Myasthenia gravis is encountered at all ages, racial, and ethnic groups, but classically the distribution is bimodal. This means that the first frequency peak is between 20 and 40 years old, while the second frequency peak is between 55 and 75 years.
Now for the who. Interesting enough, those who experience the first frequency peak are predominantly female, while those who experience the second frequency peak are predominantly male. Therefore, symptoms are more prevalent in younger females and older men.
Lastly, now we have the why. Why does myasthenia gravis occur? Since it's an autoimmune disease, the person's immune system accidentally attacks itself. Usually, when a muscle and a nerve communicate, the nerve endings release a neurotransmitter called acetylcholine that binds the receptors on the muscle, activating a muscle contraction. In myasthenia gravis, there is an issue with communication, and instead, antibodies block or destroy the receptors, preventing the muscles from contracting. This is what causes facial drooping and can also cause an unsteady walk. Back to you, Jonathan.
Thanks, Consuela and Stan. According to a 2019 study conducted by the American Academy of Neurology, functional endurance and social participation can significantly be improved for individuals experiencing myasthenia gravis flare-ups. This study examined the effectiveness of a self-management group program which combined aerobic training, energy conservation management, and relapse prevention. 2 randomized control trials were conducted consisting of 53 patients with various types of neuromuscular disease and chronic fatigue. Participants were randomly allocated to either a 4-month group intervention or to no specific care at all. Social participation was assessed through completing the Canadian Occupational Performance Measure, better known as a COPM, with secondary outcomes including a 6-minute walking test and a checklist for individual strength and fatigue. Results showed the mean group difference for the COPM was 1.7 with a 95% confidence interval in favor of the intervention group. Also, the results of the 6-minute walk test showed significant improvement in the intervention group compared to the control group. For further input on our study, please visit the website listed below. Now, to further comment on the effects that occupational therapy can have on individuals with myasthenia gravis, we have certified and registered Doctor of Occupational Therapy, Chloe, here to comment. Thanks for joining us, Chloe.
My pleasure, Jonathan. Occupational therapy, for those who may not know, is a type of therapy that looks at the person holistically, meaning as a whole. and helps them return to their normal activities that provide meaning to them. With myasthenia gravis, it's important to evaluate the client's endurance and activity tolerance to see which activities of daily living have been impacted due to their disease. We assist them in improving their energy conservation and provide assistive equipment to help with bathing, grooming, dressing, eating, and other household management. Along with the client evaluation, we also do a home evaluation to suggest any environmental modifications that may assist the client in engaging in their activities.
Are there any ways an occupational therapist can assess myasthenia gravis?
Why, yes, Stan, there certainly are. To enable clients to participate in meaningful occupations, evaluations and assessments are carried out to assist in our understanding of the client and environment. Some of these assessments used to gauge the occupational success of someone with myasthenia gravis include the Functional Independence Measure, better known as FIM, which is used to assess the severity of the disability and the impact on ADLs. There is also the Canadian Occupational Performance Measure, often shortened to the COPM, which is a semi-structured interview outcome measure used to evaluate the change in a client's self-perception of occupational performance over time. Lastly, there is the Myasthenia Gravis Activities of Daily Living Profile, which is a survey comprising of 8 questions related to symptoms experienced by the individual. Symptoms include talking, chewing, swallowing, breathing, ability to brush teeth or comb hair, the ability to go from sit to stand in a chair, double vision, and eyelid droop. Other tests can include manual muscle testing, testing range of motion, and grip strength.
Well, thanks, Stan and Chloe. That was wonderful, just wonderful news. We have to take a short break, but we'll be right back. Please enjoy this promotion for Chloe's current facility of employment, Totally a Real Clinic Occupational Therapy.
Are you someone who is feeling weaker throughout their day and unable to do things you were once passionate about? Do you seem to have recurring issues regarding vision and making facial expressions? Check with your physician as you might be suffering from myasthenia gravis. This is a rare, chronic disease that affects 7 to 20 individuals out of 100,000 throughout the United States. Luckily, immunosuppressive drugs can be there to mitigate symptoms. Really confusing names such as prednisone, azathioprine, mycophenolate, mefetil, and tacrolimus improve muscle strength by suppressing the production of abnormal antibodies. Do not take any drugs while doing super cool stuff such as skydiving, bungee jumping, laser tag, petting dogs, knitting, cliff diving, hog wrestling, or any other activity requiring significant energy expenditure. Your occupational therapist can assist you in performing these sweet occupations to increase your quality of life. Interventions with medication management or compensatory strategies can help you get back to being you. Come visit us today at Totally a Real Clinic off of American Pacific Drive here in Henderson, Nevada. Totally a Real Clinic is not responsible for any injuries caused by doing super cool occupations.
Welcome back to Tonight at 5 with Tomathan Thomas. I'm Tomathan, which at this point is almost 6, not 5. But regardless, if there's one thing we learned tonight, it's that myasthenia gravis can impair those affected from completing their activities of daily living, but with the help of occupational therapy, these issues can be managed and resolved. Signing off, this is Tomathan Thomas for KTNV Action News. Good night, Las Vegas. May all your occupations be meaningful ones.